Jim Joyce, it's Wednesday.
Wednesday, man. We got this last Wednesday feels like 2 months ago, watching.
I know. I've
Good
been
old.
joking around that it still feels like, I don't know, December 47th, 2020, just because all this shit that's going on. It's kind of
Yeah.
crazy. And, I don't know if you miss it, but I was talking to Tony Estrella earlier today, and I haven't even thought about JPM just because, I don't know, Maureen and I were just executing and not worried about it right now. I got invited to a bunch of things, but I just kind of, aside from Startup Health tomorrow, nothing really, staying away. But Tony's kind of like, yeah, but I'm like, so I don't miss it. But Tony was like, I kind of miss it. I'm
Yeah,
like, you know
I
what?
miss
And
it.
he started talking about serendipity and meeting. And I'm like, you know what? I got nostalgia now. Like I do.
Total nostalgia. To be honest, I was like, why would I go? Why would I do, Zoom or team video conferences for JP Morgan? But a lot of people are, I talk to everyone saying there's a ton
Right.
of people
Right.
doing it.
Right.
But yeah, no, I totally miss it. It's one of those, it's kind of love-hate relationship for most people. Like I have a lot of love. I have a lot of love. So I really enjoy
I
it.
I agree. I've been honestly keeping busy. Sort of launched the DTX podcast last week, and it's
Right.
it's a
Yeah.
lot of work. It's not like you and I just shooting some shit and having some
Right.
awesome guests on. I mean, it's a lot of work, I have to say. Kendall is
Yeah.
making me work, but
Yeah. So he's a pro. He's a pro.
he is a pro.
Podcasts.
Speaking of JPM, this is kind of interesting. I was just catching up with John Halleck, and he's like, dude, like you must have Scott on." And I'm like,
Okay.
"I don't think actually I've met Scott. I don't think you've met Scott."
Haven't met Scott before, no.
No, so this is a first for us, where
Right.
usually at least one of us knows the person. So this will be interesting. It's kind of like, replicating the bar thing. It's kind of like John Halleck is like, "Hey, come over," and then he runs away, right? Like, so let's pretend that.
But John's been a fan. John's been a fan of the podcast, and
Yeah,
John just
yeah.
joined. Yeah.
Yeah,
So
I just one thing I remember he was saying like, "Hey, let me have Glenn on the show too" at the time at
right,
Livongo, and I'm like, "Dude, have you watched any of them? Are you sure? We're just kind of shooting the shit."
right, right.
So on that
Crossovers.
note, let Scott Shreeve in.
Excellent. I'm looking forward to this. So we got. This is kind of. I suppose it's our JP Morgan. This is our JP Morgan podcast here, right?
This is the JP Morgan podcast, indeed. So we have him now on sound, and
Okay,
he's
excellent.
coming up on.
Hey.
There we go.
What's up, guys? How's it going?
Welcome,
Hey, Scott.
welcome.
How are you? Nice to meet you.
Thank you.
So
Good to see you.
I mean, obviously John kind of, I don't know if you know the background on this, but it's basically Jim and I usually we're shooting the shit at the bar at JPM. This is the JPM week. And we would say, all these discussions just kind of happen and then let's capture it. Right. And so this is trying to replicate it, but we're just joking around. This is kind of like John saying, "Hey, come over here." And then he runs away. And then we're kind of like looking at each other, the three of us. Right. So that's how we kick it off.
All right, I love it. It's all good, man.
But you've got you have a big, beyond running a massive enterprise, you have a very popular blog, or that's what it's sort of a crossover blog or something. So you're in the digital health sphere, constantly communicating ideas and thoughts, right?
Yeah. So that's interesting. So it's funny because I started blogging back in 2006, right? And this is when it was just kind of coming into being. And it was so weird because at the time, you're just writing this stuff, you have no idea. And all of a sudden people start reading it and writing and commenting and inviting you to speak. And,
Right.
It's so fascinating. And actually for Crossover, our first opportunity came to us from someone who was following me on Twitter. And it was an incredible deal. Just happened to be a little small company called Apple. But that was the introduction, was someone just DM'd me and off to the races. So yeah, these things you just never know how these little conversations, to your point, Eugene, will turn out and what will happen. So,
but before we dive in, because I'm been fascinated with primary care, and I love actually how you guys are using primary health. But before we do that, so you're a doc, you're a surfer. Like, I don't know you, Jim doesn't know you, our audience, well, some may know you. You've crossed paths with Matthew, Health 2.0. I mean, just so much history into all of this.
Yeah, totally. So, well, I can give you the quick backstory. So I was an economics and zoology major in college, which is a wild combination. So instead of running a zoo, I decided to go into medicine, and I found it was the same thing. So I went to med school. My first 2 years of med school, this interesting story, was in 94 and 95. So at the birth of the internet. So all my buddies were down in Silicon Valley, like doing all this cool stuff. And I'm like stuck in the library 12 hours a day, wondering if I made the worst decision of my life.
Right.
But I loved it. I loved the everything I was learning the first 2 years. But then my third year of med school, you actually start going out as a med student to practice.
Right.
And dude, I was getting up at like 4 a.m. to go chase labs and go find x-rays and bring all this paper all over. And I was just like, are you kidding me? This is how we practice medicine. And I was kind of just disillusioned. So I went through every rotation. Okay. You started with OBGYN, and man, those people are miserable. I'm not going in that specialty. Okay, next one up, surgeons. Wow, those guys are miserable, but they're at least cool. And then the orthos, love those guys, but man, I don't want to be hammering on bones all this. So I went through every discipline, and I just couldn't find what I loved. And it was really challenging for me. I kind of have an identity crisis, and I finally got to the end, and I'm like, you know what? I got to decide what to do. And so I went into emergency medicine. Okay. And emergency medicine is awesome. You work really hard. It's intense. Do all these crazy things, and then you're kind of off. You have a little bit of time to kind of gather yourself. But I chose that specialty because I wanted the flexibility, the freedom to do a couple things. And I love the intensity, and it kind of fit my personality. But what I realized, and this will tie back to this Health 2.0 stuff, was, man, every day I'm gonna do a great job. I'm gonna take care of my 30 patients. And then the next day I got 30 more. And the thing is that the nature of the conditions I was dealing with were like, they're tough, man. I mean, only about 15 to 20% of emergency medicine is actually emergencies. Full 50, 60, 70% is things that probably shouldn't be there, or these social conditions that are just, really challenging. And what am I supposed to do in the emergency room for that?
Right.
And then of course you're in the environment where I only see you once. And so I've got to do everything for you right now, because I might never see you again. And so I always laugh at my primary care colleagues who they're like trying to like figure out all these algorithms to save a few bucks. And when someone walks in my ER, I'm ordering a $50,000 test in like 2 minutes after talking to them. It's just like, it's so crazy. So coming out of that experience, I was like, gosh, how do I impact not 30 people a day, but could I do something, some business medicine and technology that could allow me to impact 3,000 people a day, 300,000 people. And so that was kind of my goal. And so I started my first company right outside of residency. And what I did is I rotated through the Veterans Administration during residency. They had actually a really cool system. And again, this is kind of 2000-ish, where electronic health records are just kind of coming into being. And so I was a big open source guy. They have this free and open available software that powers the Veterans Administration. You guys, taxpayers, spent $8 billion building it. And so we took open source software, packaged it up, and sold it to community hospitals that couldn't afford the big Cerners or the Epics of the world. And that's how I got introduced to this. And so, yeah.
And Scott, so Jim and I are in Europe, but as American citizens, we still have to file taxes. Yeah. So it's, yes. And,
Yeah, I knew you guys had escaped the domicile. So I was wondering if those taxes. So anyway, thank you, Jim and Eugene for paying for the Veterans Administration. But anyway, had a great experience there. I learned how to build companies. I learned how to raise money. We learned how to hire people to execute. And I had a little bit of an unceremonious exit from the company. And, classic VC, lessons learned as a first-time entrepreneur. But when I was removed from that situation, I was not super happy. And so I just spent all that energy into writing and thinking. And again, going back to the blog. And this is actually where I met Matthew and Indu. And so I was part of that founding team that got Health 2.0 to kind of kick off. And we were at that very first conference.
Oh, wow.
I had no idea.
And writing. Yeah. So I was,
Eugene's one.
I mean, I
James
started
Garrison.
the New York chapter, right, which was like the second chapter behind San Francisco, and then Alex Fair took over. But you know, somehow we just never crossed paths up until now. This is crazy.
You know, it was interesting. I was at those first 3 or 4. You know, once you kind of got to the 4th or 5th one, it started to kind of drift a little bit. But it was great, right? The energy was awesome. It was fantastic. You know, Matthew Holt and I started arguing, you know, from day one about, you know, what Health 2.0
as all relationships with Matthew. Yeah.
No, it was great. He took the tack that Health 2.0 would be these kind of widgets and tools and tech and stuff, which was partially what I thought it was more going to be more systemic, new models, new systems, new payment. And so anyway, I think we ended up both being kind of right. But from that, this is where it all ties together, is I recognize that, wow, healthcare's got a lot of issues. I read a book, Redefining Healthcare by Porter and Teesberg, that really made me think different about what is value and what are we paying for and what outcomes are we literally getting and can we organize differently? And so I started writing and talking and thinking about this, speaking, as we mentioned, and then I started doing consulting projects, and then I started managing practices, but I could never get people to go far enough or fast enough in that role. Right. And ultimately I just decided I've got to start my own thing. I'm just going to do it. I'm going to throw up a shingle. And that's where Crossover was born. It was a direct to consumer primary care practice. We added fitness right out of the gate. We didn't go the normal route. We had these guys who build surf shops. They designed our store. It was meant to look and feel different. The service level was different. We leveraged the heck out of technology.
Was this in California, in San Mateo, or?
It was in a place called Aliso Viejo, which is in SoCal, basically between San Diego and LA. Okay. And we just opened the shingles.
So were the patients' beds and benches were made out of surfboards, or I don't know?
they practically were. They could have been. That's all we had money for. But no, we designed it differently. We'll go into that in a minute, I'm sure. But anyway, it was fantastic. But we realized that, man, selling to the consumer one by one is really challenging.
Right.
And just at that moment, we were like, man, this is going to take us 20 years to build a business.
And were you practicing at the time? Were you actually?
I was the original doctor, right? Okay. So I was a primary care doctor with another partner and founder, and we saw patients, and we started. And so we were one of the first direct to consumer primary care practices. But again,
was it around the same time as? Sorry, was it around the same time when Jay Parkinson in New York was doing? Or?
Yes.
Okay.
So Jay was about 2 years ahead of me, and I actually saw what Jay was doing, and I loved it. And we actually were trying to use the platform that he developed, Hello Health.
Got it.
So all these pieces, you can see all these threads tying together, right?
Yeah.
Right.
And so it ended up being that right at that time, I got contacted by Apple. We went through this crazy process where we bid on the deal. Right. And just so you know, I mean, we got an RFP. It's like 500 pages long. It says, show me your last 10 years of financials, your 10 client references. And we're like, dude, I don't have any of that. So we're not even going to try to answer those questions, but we're going to tell you what we believe. Okay. We're going to tell you how we think healthcare should be. You guys have disrupted 7 industries. It's time to disrupt the 8th, and we're your partner to do it. And again, this whole long story.
I love it.
We'll have to get together and tell it, but we ended up winning the business, and against the advice of all the advisors and everyone. And Apple basically said, the reason we're going to select you guys, we love the vision. You guys feel like us, and we have bet on startups before, and we're comfortable doing that. Yeah. And we're going to do this. Oh. And I can't tell you, I mean, of all the mega opportunities at that time, I mean, this was unbelievable. It was unprecedented. And what was so fun is we got to go in with Apple, and we built a part of the clinic in a warehouse, no joke. Yeah. And we sat there and we stepped this thing out. How could you design this so that it's just perfect for the patient? How many steps to the counter? Where does the light come down? I had no idea. You could spend 3 hours talking about the directionality of a light and why that matters, but you can, and we did. It was fantastic, but we learned so much. And then we opened the onsite there. And then of course, Facebook came and like, hey, we went through this RFP process. We don't like it. We want to do something new. What's Apple doing? Hey, we never heard of Crossover. Yeah. Why don't you guys come do ours? And then it just starts this slow march, all these coincidences, all these very fortunate things. And great news for us, we were able to recruit great doctors, great team members. They did a fantastic job. We grew like crazy with Apple and Facebook. Applied Materials came, Microsoft came, Comcast came, and just started from there. And
what came? Crazy ride. How did you come up with a name? Actually, Crossover. Like, is there a significance to it?
There is actually. When I left my first company, I was in a little bit of a bad spot. Wasn't super happy, but crossover, right? That big X, right? So the logo, I took the logo, the other one, I put a big X through it, and that was our initial logo. But crossover, actually, the better story is we were really trying to go from Health 1.0 to Health 2.0.
Okay.
And the challenge of doing that is you've got to cross this big chasm. And what is going to help you thread the needle? And what we found is I can't really drag 1.0 into 2.0. I actually had to start de novo. And that was really important. And the biggest innovation we did at the beginning was to get off fee for service. And we had to learn how to get paid. Well, how can we create value that either members are going to pay us or now these employers are going to pay us?
Right.
And that was the biggest leap for us. And we had to figure it out. I mean, there wasn't a game plan. There wasn't anything we could follow, but we entered into this world of the self-insured employer. We didn't even know it existed. And these guys, they pay for their own care and they just write a check. They don't even know like what's going on. They don't know what value they're getting and they just write a check. And what a lot of these early companies were doing, we call them health activists, employers. They're like, hey, I'm done with that. Listen, I know how to innovate. I know how to manage supply chains, and my healthcare supply chain is totally unmanaged.
Right.
I'm just writing a check. And so forget that. I'm going to go direct. I'm going to engage a medical group to deliver broad spectrum primary care. And so this is now where the term primary health comes from, because it wasn't just the doctor and the nurse. If you're going to engage a lot of the population on the core needs that they have, you have to add physical medicine.
Right.
You know, PT, chiro, acu, and fitness.
And health coaches, selfishly spoken.
Okay, I'm getting to health coaches. The next part is you got to address the rest of the body, which is mental health, health coaching. And there are other services which we ultimately added, which is care navigation, right? And so this integrated, coordinated, comprehensive team came together, and they were applied to a specific population. It wasn't that you're getting some random doctor. You get your doctor, your care team, and that became really important to establish the trust. One of the things I want to say is the reason why we perform so well at Apple, as you guys know, they're all about the experience.
Sure.
But what everyone knows that. But what they don't know is the reason they care so much about the experience is because it builds trust. And we learned that, man, if we can build trust with the members, then we have the ability to do this. And to build trust with Apple employees at the time was not only a great service experience, but you had to have great tech. Right. And this is kind of ties us back to Jay and some other things. A lot of the concepts that Jay had, we were trying to apply as well. And ultimately, 8 years later, we connected with Jay, and Jay is now part of Crossover, which is just another story we'll get to, I'm sure. But
wait, I didn't realize that. When did that happen?
Yeah. So what happened is so Crossover started.
Let's dial him in.
Yeah. Skip ahead. We started as on-site, right? So we would build these tricked out health centers on the corporate campus. And remember, the Apple one, it's custom, right? So it looks like an Apple store. It's unbelievable, right? And they spent the money to make it look like an Apple. We go to Facebook, it's steel, concrete, and pipes, you know? And that works for them. You know, Applied Materials, they had another vibe. And so we could build these centers and operate them. But then the next pivot was to say, okay, that's cool, but there's not like infinite mega clients like this. How could we provide that same thing, but maybe have multiple clients or employers share it? And that was the near site.
Okay.
And so now we moved off campus into a tight geographic area where many employers could do it. And then what our realization was is, man, we're going to be like Blockbuster. Like we can't build enough of these physical centers to get there. We have to surround the rest of the population virtually. As it turns out, 70% of all the employees that we employers that we work with, 70% of their people are remote to the headquarters or where we're building centers.
Okay.
And so what we realized is like, listen, if we're going to provide this model to the whole population, you've got to add virtual.
Right.
And so that was 2 years ago. So Eugene, to your question, at that time I went back to Jay, and I had stayed in touch with Jay. You know, he's a social media phenom. And we had stayed in touch, and you know, he had so many great ideas with Hello Health. Sherpa was the first virtual primary care, not an urgent care thing, right? It was true longitudinal care. And Jay had been through his own kind of challenges with, you know, the finance, you know, institutional investors and so forth. And so we were able to kind of come together after having that shared experience, bring his 8 years of experience doing virtual care, kind of walking through the desert as the lone prophet, you know, talking about this.
Right.
And just bring it in-house, because we had arrived at the same conclusion is, listen, we don't want to be Blockbuster, and we want to move to more of a Netflix model, but we don't have to choose between them. We can actually be both.
Right.
And so where crossover has landed in this really beautiful spot where we are virtual first and then strategically in person.
Right.
And that is an important phrase. And I can break that down. What that means is we start almost all the interactions online because it's efficient, it's asynchronous, it's fast. I can triage you, I can take care of you, and we might just be done at that point. Then maybe that addresses the situation. Or if it doesn't, then let's get you in and we'll physically touch you and we'll get your vaccine or draw your blood or lay hands on you as appropriate for whatever the condition is. And it's really the combination that is so powerful. And that's really where we've landed now. So let me pause there. That's a lot to throw at you, but
we'll peel the onion.
Story.
You want to jump in, but I get. So what's the loads of questions. What's the wildest as an emergency, as an emergency room physician or in emergency medicine? Like, what's the wildest scenario that you've stepped into? And are you just kind of when you it seems like the perfect training for entrepreneurism is emergency medicine.
No. In retrospect, it really is fantastic for that because what happens is it's what's behind door number one? You never know when you walk in the room what it's going to be. It could be someone who's got an earache. It could be someone who's suicidal. It could be someone who's got a roach. They stepped on something. It could be someone who's got a knife in their belly. It's just and so the context switching is perfect for a startup company, right? Just boom, 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 boom. I'm all over. And what I always tell people, because I'm a little bit, people are like, man, you're doing 5 things at once. I'm like, I'm a trained hypertasker.
Yeah.
I was trained to do 10 things at once. And so that's helpful training. Yeah.
We gotta grab that one, Eugene. That he's a hyper.
I'm grabbing it. Exactly.
Which is kind of a weird thing. But what I did, so that's where that came from. But the craziest stories, we could go on for days, but I saw funny crazy, and I saw really sad crazy, right? And so some of the funny crazy, just people with all kinds of implements inside their bodies where it probably shouldn't be, roaches in people's ears, and crazy stuff. I was in the University of Tucson in Arizona, so there's a lot of desert stuff. So rattlesnake bites, scorpions, dehydration. And unfortunately, there's some terrible situations where, people coming across the border being shot at, and
Oh.
drug dealers kind of 150-mile-an-hour car chases. And
Eugene, we got to break for a joke here. So I'm on a flight.
Those.
I was at a Health Excel. Health Excel. Do you know Health Excel, Scott? Or one of the digital health
accelerator startup thing.
Accelerator, yeah. But anyways, they were running an event in Mumbai, and I was hopping on a flight from Mumbai to Singapore, and a very healthy looking kind of young man on the flight, kind of almost Abercrombie Fitch kind of dude, kind of walking across the, and he just collapses in front of me, right? And so this is what I'm thinking of you, Scott. He collapses right next to us, and we're on Singapore Airlines, which is the slickest airlines in the world.
Oh yeah, they're smooth. Yeah.
And they're so slick, and they're unflappable, and they're and
I miss those days of airlines.
Flying. I know they went in, Scott. They went into total meltdown. It was strange, right? Total meltdown. And then sure enough, and then the crowds. So we're going from Mumbai, so it's it's the Indian people flying to Singapore. So the crowds start crowding around this guy, and everyone's like, "Get back, get back, get back, get back!" And then they're like. And then so they finally fight everyone off to give the guy space to kind of look at the guy who just fainted. And then they go on the intercom and say, do we have a doctor in the house? And then 70% of the plane stood up.
Yeah, exactly. It's a good place to be on a
plane from Mumbai to Singapore. They're all doctors. And they're either doctors or engineers. Yeah, and then they were clearing the doctors away. They're
No, that's great.
But anyway. You know what? Before we jump to the next, because you talked about Microsoft, tons of stuff. We just saw the disassemblance of Haven, and we also know Amazon is a customer of yours.
Yep.
And I also know they've gone, Whole Foods, and they purchased. There's a lot of activities in that umbrella. Talk to us. What is it like working with Amazon?
Yeah. So first of all,
did they disassemble Haven because they're doing more work with you, and they said, screw the rest?
Of course, no. Yeah. So I actually can't really comment. So one interesting thing about Amazon is they are so massive, and they're adding, when they add employees, they don't add a couple hundred. They're adding 100,000 tranches of employees. Wow. And so it's such a big organization that it depends on which part of it you're working with. So Haven, we were familiar with that team. We had met with them, but they were kind of off doing something separate.
Yeah.
There's a small group of pilot activity going on up in Seattle, and we're not really privy to that. So the group that we hitched our wagon to was the operations group. And these are the guys that are doing the fulfillment centers, the logistics, all of that. And the person who runs that is the worldwide leader of that is a gentleman by the name of Dave Clark. And Dave is known for his own bias for action, and he takes things seriously. And he really was adamant about getting primary care and getting access to the employees, but not just the employees, but they're also their dependents, and not at or near the workplace, but in their neighborhoods. And so I love this project because, we had bid, the reason we got to know Amazon is we had bid on their on-site center that they were going to do in 2017. And we successfully competed for that. I think they really liked us, but they ended up not doing that. It never moved forward. But they knew us from that. And then when they were ready to move forward with the operations, they selected us as part of that process there. And what they're doing is so interesting. And this is why I love it. I'm going to say a term, and I hope you guys can get it, which is the model that we practice that I like is that it's surround sound care that also streams, right? And what I mean by that, so think about what Amazon's doing. They have 50,000 employees in Dallas. And what they're doing is they're saying, okay, everyone in Dallas, you're going to have access to Crossover virtually. They have a whole care team and they're dedicated to you. You're going to get to know them. And in addition to that, I'm going to build several small, what they call neighborhood health centers. And what the term we use is they're basically confirmatory centers. So they're nodes on the network, if you will. So you add this virtual network, and you add a few physical nodes, and then they join one of our near sites. Okay. And so what you create is exactly what I said. It's virtual first, strategically in person. Okay. And so they can access us 24/7. They can access the care team. So we surround and envelop them. And in our model, any patient who engages with us, we're tracking over 40 different clinical metrics on every patient. So we know your social determinants of health. We know your prevention and risk screening. And we also know if you have any conditions, like if you have asthma or diabetes or certain things that you need to check off for those guys. So everyone who engages with us gets that. And what I really respect about what Amazon has done is that they don't mess around, man. They're like, hey, we're going to do this in 5 states, 5 regions. And we want it done in 5 months. And so that was
5 is the magic number.
We had to step into this and, to recruit and to build and to implement. And so we've done it. And we now are launching our 3rd region with them. We have 2 more. And again, this first phase of the project is only 100,000 employees. They have 800,000 in that one division. And so the opportunity here is to take this model. We've got to prove it out. I mean, Amazon is very metric driven, as you guys would expect. They're operationally incredible, and they have high expectations that this model delivers on what it says.
Sounds like you guys are as well, though. And that's the culture.
Well, we had to, listen, I mean, they're no joke to work with. And many of our clients are the same way. They're very high demanding. I mean, these are just, innovative, impressive companies in their own domains. And then they walk into healthcare. It's like my experience as a medical student. I walk in, I'm like, what? This is healthcare? Like, this sucks. I mean, like, let's do this better. So they're wanting to really apply the principles to execute. And so we've had to step into that. We've had to grow into that. But man, you go through your reps with Apple and Facebook and Microsoft. I mean, those clients are also very demanding because they have a clear vision of what they want. And now we're kind of ready for like an Amazon to come in and really be aggressive about how they want to go forward. So we're thrilled about this. Now, the question everyone asks is, well, what's going to happen? What's Amazon? And, we just don't have insight into that. We couldn't speak for them anyway, but I'm thrilled that companies like Amazon, like CVS, like Walgreens, like Walmart are getting serious about this. This is a huge national problem that we have with access, with care quality. And listen, bring all the innovators. And these guys happen to have capital to be aggressive about this. Let's get these models out there. And I love the fact that they're not just doing some cheap kind of urgent care telemedicine solution. This is integrated, coordinated, comprehensive primary health, the full set of services. At Amazon, we added pediatrics because they really want the family to be taken care of. Our hours aren't 8 to 5 at Amazon. They're from 7 to 11 at night. And they're on weekends. And so we're adapting the model to address, one of the most challenging people to service who are working around the clock. And I just applaud their vision. I applaud their effort. And it's a privilege to work with them. And I can't wait. I hope we're just getting started and we're just going to continue just to do this. I mean, can you imagine when 800,000 people have access to a model like this.
Amazing. And Scott, when you think about like, so, and I'm not interested in like, I don't want to have you talk about a specific client, but when you think about this, it sounds like in some of the people we've talked about, you have this kind of, millennial, like I'm picturing this kind of, engineers and probably generally fit people, and, what would surprise you? What would surprise someone on the outside about their healthcare needs? Like, when you look across those groups.
I think, and again, I appreciate that. And but I'll share a couple things about that. Number one, when we first started, our first few clients were just these unbelievable Apple, Facebook, that's incredible. Right. And so, but also it was funny because the negative of that was like, oh, you're just like tech elite, healthy young people providing some gloss across the top. And that always used to bother me. And I'm like, you know what? That's not right. Like this model is so much more than that, but it was our Tesla Roadster days. I had to build the epic sports car. I was with the elite employers,
right.
but we built the thing, we got the rails built, but now I could extend it. So the Model S for us was to go to the near sites, open it up to more types of employers, right? And then you extend that further with virtual. I get more and more people because now smaller and smaller clients can join a model like this.
Right.
And then ultimately, I want this to be available to everyone. And so part of the building that we're doing gives us the infrastructure that I can take on individual members at some point. And that's really our goal. Our goal isn't just
so back to D2C. No,
yeah, go ahead. Jump in.
Back to D2C. No, I'm kidding. When you said individual members, so I was just saying, like, are you jumping back to direct to consumer or being available?
So here we go, Eugene, full circle, right? So we started direct to consumer. We went to the employers. We're gonna expand to payers, and ultimately, do you just go right to retail again because you've built that infrastructure? And so I'm kind of charting a course, and you can see how you have to take each step, right? You can't get right to the Model 3 right away. You had to go through the Roadster and the S, right? And so I think this is an evolution. It's a long game. But I mean, this is it. This is what I wanted for my family. Like part of what I built here at Crossover was exactly what I wanted. I wanted to have a relationship with a care team. I wanted them to be available all the time. I want to engage them with online. And I want them to be proactive in monitoring my health with me in partnership. And if I need something in the secondary care system, I want to have someone help guide, steer, navigate me and make sure those loops are closed. And that's what we built.
Just to try to ask one more that time, is there something, because I agree with you. Like, I mean, it's what a great way to kind of build a system, that people are willing to invest in the design. And you talked about where the lights go in the room and everything else. But is there something that would surprise us about that group of people? Like even saying it because they're important members.
Yeah. I'm sorry. I didn't answer your question.
But then also like, how are they doing now? Like, we need people like we're all like, I feel like companies like you're talking about their infrastructure right now. Like, thank God we had all these tech companies, during the period we're in here. Is there something that would surprise us about the people? Is it like?
Yeah, a couple of things. Where I was going to go with that is we got criticized initially because it was just like the tech elite, right? And then you start to spread. And so let me go all the way to Amazon. Now I'm dealing with caring for warehouse workers in Kentucky and middle of the country and all these other things. So the health issues that we see are markedly different across the country and across these populations. But what's so fantastic is the chassis of the care model works perfectly.
Okay.
What I do have to do is I have to switch out parts. When I'm in Silicon Valley, I don't think it'd surprise you, but I'm going to have way more mental health issues, anxiety, depression, stress related things, coping, relationships, performance, a lot of physical medicine, a lot of active people otherwise. When I'm in other places, now I have more social workers. I have more care navigators to access the rest of the system. I have more care programming to get more healthy. So, but it's the same model. It operates the same, but the constituent parts are different. So I don't think
you're virtual.
On what we're seeing there, but anyway, go ahead. Sorry.
No, I was saying, and you're virtual, right? And I think, my question would be, and we're not allowed to say, but you can raise the sign. So this is, the C19 free zone, but you mentioned, you even got the card. Holy. I love it. You prepared. You mentioned you guys are virtual first and tele first. Where do you think, let's presume you guys got into, I'm sure, vaccinations at the primary health level, all of that. After, let's look at the world after. Tele-virtual stays, goes, still a big component. What's your prediction?
I'll make sure you get some. We have some really, really interesting graphics that show the whole pandemic. I have a graph on our care engagement throughout the whole year, right? And so what we're saying is we started in January and February, which was our kind of core business. 90% was in person and only about 5 to 10% was virtual. Okay. COVID happens and it completely flips. You know, maybe 10% was in person and 90% wasn't. And then what I think is so fascinating is now you've seen the evolution. So over the ensuing 6 months, we've kind of landed in this really sweet spot where we're about 40% in person, 40% online, and 20% is all of our proactive work. One of the things that this did, C19, was it helped the employers see that, oh, you guys are actually a health monitoring service. I never thought of you that way. Because on a daily basis, they had to know the health status of their employees. Do you have symptoms or do you have a temperature? They never had to do that before. Right. The other thing, when someone gets COVID-19, they don't, it's not like, oh, I can do this in a 10-minute visit and you're good. Yeah. Like it's an evolving situation over weeks. And so our care team and the model, that's where that streaming care really comes into play. Like we're continuously in touch with you. How you doing? Do you have your medicine? Do you need transportation? Do you know, what else can we do for you during this time? So I think what's happened is we've landed in a new equilibrium. I don't think we're ever going back to 90-10. I think we're going to kind of stay 40-40. And this new body of work, this proactive outreach, which really demonstrates the model, the employers finally get it. They see it now. They're like, oh, I understand now why that's valuable.
They also have to get it now, right? I mean, they always had to, but now it's like there's no freaking choice, right? I mean, there are so many things. Man, I'm gonna pop this crazy question because I just saw. I think either Halleck. I mean, I saw the post. So you guys are on the NASDAQ screen in New York City, if I'm not mistaken. You know, John joined you. I think Katie Higgins. I don't remember the rest of the folks. And you're presenting at JPM tomorrow, if I'm not mistaken. I did some research. IPO, man. I mean, are we the first ones going to ask you that question? Or I don't know.
Oh, yeah. Unfortunately, I think everyone asked that question. But
damn.
No, so I mean, here's the deal, right? So these businesses are typically very capital intensive to grow these primary care businesses, get all these centers stood up and so forth. One of the things that we did that was really smart was, in our case, it was very capital efficient because the employers were paying for a lot of our first build outs, right? And then we learned how to build them and then we could build them very efficiently. So we were always capital efficient, but you do need capital to grow. I have to be ahead of some of these things. I have to build a national virtual infrastructure, 4 regions, 10 to 15 people licensed in 10 to 12 states in every region. Those things cost money. And so we historically have been kind of VC and private equity backed company. And, our last raise was 4 years ago. We've been super efficient with that capital. We've continued to grow. Our metrics are getting into the zone where people start thinking, well, what other investors might want to access this? You got to start looking at public markets. I'm really grateful for the work that One Medical and Oak Street have done to train investors about primary care models. And so, of course, the way we always answer this question is, of course, we're looking at all the different options. I think the public markets are very interested and excited about models that demonstrate value, that are growing rapidly. And so hopefully we fit that profile. So, we can't really speculate on where that goes, but I think, you guys are smart at reading the tea leaves and where all this all goes. But I will say a couple of things about the talent. One of the most exciting things for me is to have great people want to be a part of this mission. I mean, 10 years ago, we're kind of slogging it out by ourselves, writing these blogs and building these centers, and we had no idea if anyone was paying attention. And 10 years later, to have the caliber of people like John, like Katie, like Dan, like Amy, and like all the others that are here, as an entrepreneur, I mean, that is so awesome. And I'm so grateful. And I'm excited that this is the type of opportunity that will attract that type of talent. And I really think we're just getting started.
You seem like just massively energized by this. Are you finding like now as the company gets bigger that, your tasks change? Like, Eugene and I are both entrepreneurs and built up companies. Do you find like I love like the product side, like you can see maybe, like I love that creation of the product. Do you find now that you're managing a system, and is that,
Yeah, if you go back and you ask the other founders, what's the most exciting part of the phase of the company, ask any founder, they usually go back to the origin story, the original, like winning Apple, winning Facebook. And that was so crazy how we did that. What happens, as you guys know, as you go through these different stages, you get more and more people, and you've got to start parsing more and more things away. And what I learned my first go round, remember, this is my first rodeo. I got kicked off the horse the last rodeo. So this rodeo, I know how to hold on a little different. And one of the ways you hold on is by letting go, and by getting great people who can take those tasks, who are better at it than you, and stepping aside. And so I feel like with these latest rounds of hires, you can see exactly what we're doing. John's coming in and he's introducing us to the whole investment community, a group we've never really talked to. We've been very much under the radar. Okay. A new marketing person to get us out there. Katie's coming on board to take on the revenue. Getting to $100 million of revenue is great, but we've got to get to 500, right? And so, who's going to help you do that? And Dan and others opening up new channels for us. So we're so excited about that. And I am energized, and my role does have to change. Now, one of the things that you guys both know also is I've got a lot of habits from being the guy who was sweeping the floors and getting involved in everything all along the way. So I'm learning to let go of all that stuff. It's okay if that period at the end of the sentence isn't quite right, or the font isn't right on this thing or that. So that's my development, is how do I get away from that and really start to do the things that are unique to my role.
Did you cry when you got the Apple contract?
Dude, it was like every pore of your body was like put into this thing. And it was tears of just exultation, joy, pain, suffering, torture, whatever. It's just everything at once.
Not sure exactly what the feeling is, but that's a good description of it.
Yeah, that was a medical description, by the way. So
yeah. What's the ICD-10 code for that?
Exactly. That's awesome. Yeah, we should come up with
fantastic, man. So I'm the negative Nancy here, because we're sort of coming up to. I know we've stretched it last year a bit, Jim. But
are you going to come international? You're going to come international, Scott? Are you going to?
Good question.
So a couple things. So I was going to ask you where you are in Ireland, because one of our projects with Apple, as you know, global operations, and so we actually are providing the software that powers the clinics in Ireland and also in Singapore. And so we don't run those, so they're run by a third party, but it's our software that historically has operated those, and a lot of internationalization kind of issues and stuff. But it's been a great experience, and Apple's done well running those clinics. So that's been our reach.
I mean, if the first place to go is you should put this in Ireland, because the obviously we'll put the tax aside, but but with all that Facebook headquarters and Google headquarters.
Hey, I just got to Spain like a couple of months ago, but Canary Islands, 4% tax rate. I mean,
like California, we're trying to tip into the 60s. So hopefully,
the employer now, I know we're going to run off the air here, Eugene, but the employer, I feel like, see, it's very different, as you know, I'm sure Scott knows when you're in Europe, is that, as an employer, we have 40 people and, Health Beacon, where my role now in terms of being concerned about the health is just because we're not, the private insurance doesn't run through the employer the way it does in the States, right? So you're not, it's not the central provider insurance, the employer here, but now, you're so concerned and you have such a role and you have to make policies that are just so different, that I would think that the role the employer is going to take is just changing so fast right now.
It is. And I think, so I think what's happened is, and we saw this a long time ago, was that the employer is a very innovative payer, right? They just never thought of themselves that way. And I think as the dollar amount that they're spending on healthcare and the percentage amount continues to go up year after year after year, they just can't not avoid it. I mean, the example that's always used, if Starbucks pays more for healthcare than they do for beans, and Ford more for healthcare than they do for steel. I mean, that's a competitive problem. I mean, they're going to have to address it. So now you're seeing CFOs and CEOs get involved. And one of the things just to mention is, as they look around, they're like, what is the problem here? Why doesn't this work for us better? And, they start to look around for models that work. And one of the models that seems to be catching on and getting some traction is, in the Medicare Advantage space, right? There's so many different innovations, these care models that wrap around these populations, they have a unique set of services and so forth. And I think a lot of times the commercial employers are like, hey, where's my Medicare Advantage equivalent? And one of the things that we try to teach them, we try to coin this word, is that Crossover, if you think about it, we're really a commercial advantage plan for you. We have a broad set of services. It's primary care. We're purpose built for this unique population. We're technology enabled. We're proactive in our care model, and we're willing to take on risk and accountability for the outcomes.
Yeah.
And so now they're starting to say, wow, okay, now we're talking. Okay, well, how do we get more people into these models? And again, our dream is not to just work for the tech elite or whoever, but to really expand, to open this to everyone. And one of the things I didn't mention about the Amazon project, I love it because these are warehouse workers. These are people who maybe have health insurance for the first time in ever or a long time.
Right.
They have real issues. They have physical issues. There's mental health issues. There's social issues. And just like any big company, but what I'm saying is that this model is purpose built for this. This isn't just for healthy young engineers in Silicon Valley.
It must be fascinating though. Like I just think about just keeping because the difference now for us as an employers is like whether I can open my business or not. So it's not just like, I have a KPI or 10% people, I got 10% uptake in the flu vaccine. So I get some days back for work or some theoretical, but now it's like I'm looking at my offices is like, it's like my air quality. I got to think about my registration procedure,
I love where you're going. So here's what happened, right? These HR people that were kind of in this sleepy job, not trying to create any waves, they are now front and center. They are public health officials.
Right.
Yep. And
they have no idea what they're doing. And when COVID came, I mean, one of the things we did was we wanted to put out a framework for them to even think about this. You got to screen, you got to evaluate, you got to test, and you got to treat. How are you going to address those things? Do you want people on campus? You're going to keep them off. And so, that was a big morass. And so we provided, one of the fun things we did, we were a technology company too, right? We built our own software. So we built what we called Passport. And what it is, it's a self-assessment. You just, you check your temperature, you ask the questions, and you can get a passport to come on campus. And it was very simple when it started, but now it's starting to say, well, what about testing? What about your antibody testing? What about your vaccinations? Who's keeping those records? And are you going to have to show those to go somewhere? Are you going to need a passport to get on the airplane that doesn't show that you've been vaccinated, but shows that you have antibodies? And I wrote a paper or a piece called Proof of Immunity. And I think this is where this is going. And I don't know if it's dystopian or if it's like a great thing, but like, are you going to have to show your proof of immunity to get into a concert, to go to a movie? And maybe you will. And then the question is, well, who is your healthcare notary? Who is signing off that thing that you have on your phone is actually legit? And I think that's going to be an emerging role for medical groups, is to be a healthcare notary to say, yes, that test was legit. I'm going to stand behind it and put my name on it. And now people can use it to have access.
100%.
QR code it. Yeah. I don't know.
I don't know about it.
QR code.
I'm very ambivalent about it because it's a lot of social liberty stuff, but
it's a tough and only time will tell, right? But I think honestly, my eyes are all in Israel now, as they're so aggressive in vaccinations, right?
That's me too. I'm obsessed over Israel.
And I was actually talking to Ofer from Happify yesterday, and he was reading me something in Hebrew, translating an article that some early data points is that actually the infection rates are subsiding in certain areas with more vaccination. So let's see,
Yeah.
Anywho, I'm gonna stop us just because we can keep going for hours, it feels like, and I think our listeners and viewers already have Zoom fatigue and podcast fatigue. So it was awesome, man. This worked out. I was a little nervous, I have to say, Scott.
No, I really enjoy. Appreciate your work. I was able to watch a couple of your podcasts before, and it's so great to have people just trying to get the real story. And one of the things I say, and maybe we'll leave with this, is, for any entrepreneurs out there, it's going to feel like you walk through the desert for a decade, and that mirage just keeps extending. But if you just persist, it's there. And what I like to say is, I love that phrase, gradually, then suddenly.
Yep.
People might look at us and like, hey, we're like an overnight success, 10 years in the making.
Yeah.
And what I love about this is, if you just persist, if you can get great people around you, if you can have a great vision, mission, and the passion, and you stay with it, you can just begin to will some of these things to happen. And in our case, we had to wait a little bit for the market to catch up. We had to wait for some things to drop for us. We had to wait for some of these contracts to happen. But now I feel like we're really at that moment where we hope to get this model as far and as wide as possible to as many people who need it, and will just tremendously benefit from it. And that's what I love waking up and doing every day. And that's where that energy comes from. That's where that passion comes from. And again, really appreciate having a few minutes to share it with you guys. So
gradually.
This was fantastic.
Gradually and suddenly. I love it.
Exactly. Scott, thanks, man. And I'll try to tune into your presentation in case you make some announcements tomorrow.
Okay, all
Cheers.
right. We're always dropping bombs. Okay, thanks again.
Yep.
See you guys.